Providence Medford nurses are set to start a strike tomorrow morning.
Nurses are striking for better pay and benefits, but also because they want to give better care for their patients.
Joining us live from the location of where the strike is supposed to start is Newswatch 12's Luke Doughton.
Luke, good morning. You talked with a Providence Medford nurse and with the chief of staff for O&A.
Brinkley, Damien, good morning. Nurses are really hoping that this strike is going to bring attention to Providence, what the nurses want and need. I talked to Caroline Allison. She's a registered nurse with Providence who will be striking in just less than 24 hours, about right where I'm standing. She says that Providence has had trouble keeping veteran nurses on staff. This puts more demand on the nurses that are staying and the new nurses that are coming in, which is part of the frustration. Nurses are striking though because they want to give their patients the best care that they can do possible. That's why while the strike, it's deemed necessary, it's emotionally tough for them to step away from their patients.
It's hard for a lot of people, the idea of leaving the bedside for 3 days to come out and strike because they're nurses and they want to be taking care of patients.
Besides bringing nurse pay closer to other Rogue Valley hospitals, nurses also want assurances in their contract that will help them take care of their patients. Allison told me that even though the Oregon Safe Staffing Law went into effect on June 1st, nurses want that language in their contract too. Now we're going to come back to me real quick. If you've been following our coverage, you've probably already seen these fences. They were put up last week by Providence Medford, and they said it is for the safety of their patients entering and leaving the hospital. I talked to Scott Palmer. He's the chief of staff for the Oregon Nurses Association. He's dealt with other Providence strikes before and says he's seen these fences there. He says that they kind of send a bad message to the nurses and to the community.
These nurses in Medford are your viewers, neighbors, and family members, and friends, and colleagues, and caregivers. The message it's sending is really, I think, just in terribly bad taste. And it's also an enormous distraction.
And tomorrow I'll be right back here at 6 a.m. At the start of the strike, we'll be talking to a nurse on the picket line. I also have an interview later today with a Providence executive, and you'll also hear from them tomorrow morning. Live in Medford, Luke Doughton, Newswatch 12.